April was a cruel month for India. The country recorded an unprecedented 6.6 million new cases of the novel coronavirus disease. Officially, the virus also killed more than 46,000 people across the country, according to the World Health Organization. While everyone is talking about India breaking new records of more than 400,000 new cases in a single day, there is another unsettling trend that has come to the fore. The virus is spreading to rural India. It is spreading fast and unlike the first wave. It is causing many more deaths this time around. April 2021 was the first time that rural districts recorded more deaths than urban districts, even though the overall caseload was higher in urban districts. According to a down-to-earth analysis, rural districts accounted for 45.4% of the new cases in April 2021. Yet, for the first time, it saw 50.8% of COVID-19 deaths last month. The point to be noted here is that rural districts in at least 10 states and union territories recorded more cases and deaths in April. The list includes high-risk states like Uttar Pradesh, Bihar, Madhya Pradesh, and Rajasthan, among others. In Maharashtra, rural districts accounted for 42% cases, but almost 60% of the deaths. So, as the virus slowly spreads to the heart of our country, what all might be the reasons for this upsetting new trend? With the worst hit states, including Delhi and Maharashtra, imposing lockdowns, the country is triggered into another massive reverse migration. India witnessed a very similar crisis last year, with September 2020 recording more than 50% of the deaths, as by then, the bulk of the rural migration was over. More importantly, health infrastructure in rural India is substantially weaker than in cities. Over 65% of India lives in rural districts, as per the World Bank. Yet, only 37% of the beds in government hospitals are in rural India. Lack of awareness and reluctance to submit to testing and treatment makes the rural population more susceptible to COVID-19. And to top it all, the official numbers, especially in rural districts, are misleadingly low, owing to the limited testing and delayed results. The rural march that started in April is likely to only worsen in the coming months, as the second wave is yet to peak in India. And if our villages fall into the deep clutches of the COVID-19 pandemic, it can very well lead to a knockout blow for the country.